Hi all, welcome to Registered Nurses channel. Today I am going to talking about cardiovascular system or circulatory system. Some of the things that you really need to know. This is gonna bring you about things that you really need to know for the exam. Just as a quick point, okay. So first of all, heart rate. What is a normal heart rate? Well, we all know that our normal heart rate is 60 to 100. And the sinus tachycardia is going to be over 100 beat per minute, and the sinus bradycardia is going to be lesser than 60 beats per minute. And the way that we all obviously going to assess that is going to be through our EKG. We have our PQ, RS and T. You can see here, this is going to be a complete cardiac cycle, and this is a mechanical representation of one complete cardiac cycle. And we are looking and hoping that our patients are between 60 to 100 beat per minute, and sinus tachycardia is going to be greater than 100, and sinus bradycardia is going to be lesser than 16. Okay, now look, now very quickly let's talk about a vesicular system. Hopefully this is not the new information to all, but our vesicular system consists arteries and veins and vesicles and arterioles and capillaries, etc, etc. Here you can see the red is indicate arteries, and the blue is indicate our veins. Okay, veins carry deoxygenated blood back to heart, and the arteries carries oxygenated blood to the tissue. Let's talk about some important points. What is a normal pulse pressure? Is 40 mm of Hg. And what is the pulse deficit? Difference between apical and peripheral pulse. That is called a pulse deficit. And mean arterial pressure അല്ലെങ്കിൽ മാപ്പ് എന്ന് പറയുന്നത് മാപ്പ് എന്ന് പറഞ്ഞാൽ എന്താ? ഇറ്റ്സ് ടു the equation മാപ്പ് കണ്ടുപിടിക്കാനുള്ള equation ആണ് 2 into diastolic blood pressure plus systolic blood pressure all divided by 3. So here is one example, 120 divided by 60. So the final is 80. This is the map of this calculation. Now let's talk about some important questions. First one, the normal mean pulmonary artery pressure. Options: 50 to 20 mm of Hg, 10 to 15 mm of Hg, 25 to 30 mm of Hg, 20 to 25 mm of Hg. The answer is 20 to 25 mm of Hg. And the patient is on beta adrenergic blocking agent. What observation a nurse should make? Options: decrease in blood pressure, dyspnea, increases in heart rate, depression. What is the answer? The answer is decrease in blood pressure. Which of the following blood test is most indicative of cardiac damage? A. Lactate dehydrogenase, troponin I, creatine kinase, none of the above. Troponin I is the right answer. Which of the following medication is given sublingually to manage angina pectoris? A. Aspirin, nitroglycerin, warfarin, none of the above. The answer is nitroglycerin. Which position is best for patient showing signs of shock? A. Semi-Fowler's position, B. High Fowler's position, C. Trendelenburg, modified Trendelenburg. The answer is Trendelenburg position. Most common cause of acute bacterial endocarditis is Staphylococcus aureus, Staphylococcus viridans, Staphylococcus intermedium, Candida albicans. The answer is Staphylococcus aureus. The electrical activity of the contraction of the heart is initiated by the A. Sinoatrial node, atrioventricular node, myocyst, motor cortex of the brain. The answer is sinoatrial node. What is a PR interval time? PR interval time എന്ന് പറഞ്ഞാൽ എന്താണ്? The time taken for the transmission of impulse from SA node to Purkinje board. That is called PR interval time. The time is 0.12 to 0.20 second. Very important. And what is the management of ventricular tachycardia with the pulse? A. Lidocaine, fosinopril, atropine. The answer is lidocaine. What is the management of pulseless ventricular tachycardia? That is defibrillator. Most dangerous dysarrhythmia, ventricular fibrillation. Sawtooth appearance in which dysarrhythmia? Atrial flutter. What is the drug of choice for heart attack? Atropine, furosemide, digoxin. The answer is digoxin. What is the action of digoxin? The drugs which reduces strain on the heart and help it maintaining a normal, steady and strong heartbeat. Before we administering digoxin, we should check the apical pulse. If the apical pulse below 60, we have to withhold the drug and inform to the physician. And digoxin toxicity, when when we are administering digoxin, there will be a side effect like bradycardia, halovision, nausea and vomiting. So antidotes of digoxin is digibind. ഇത്രയുമാണ് വെരി ഇമ്പോർട്ടൻറ്റ് ക്വസ്റ്റ്യൻസ് റിപ്പീറ്റഡ് ആയിട്ട് ചോദിച്ചുകൊണ്ടിരിക്കുന്ന ക്വസ്റ്റ്യൻസ്. സോ വൺസ് അഗൈൻ താങ്ക് യു സോ മച്ച് ഫോർ യുവർ ടൈം. എല്ലാവരും ഈ ചാനൽ ഇതുവരെ സബ്സ്ക്രൈബ് ചെയ്തിട്ടില്ലെങ്കിൽ സബ്സ്ക്രൈബ് ചെയ്യുക, ബെല്ലൈക്കൺ ക്ലിക്ക് ചെയ്യുക. സോ ഞാൻ അപ്ലോഡ് ചെയ്യുന്ന വീഡിയോസ് നിങ്ങൾക്ക് നോട്ടിഫിക്കേഷൻ ആയിട്ട് വരുന്നതായിരിക്കും. താങ്ക് യു സോ മച്ച്.